The big important things out of the way. First one is movement. So a little arm lock and just move through that joint. I can open up my knee angle and hit all different positions, both directions. And realistically, the slower I go, the more activation of all those little muscles, and you'll start to find areas that are more difficult. From there, I can do just a little bit of isometrics, activating. Doesn't need to be much, just send some signals there. So maybe a 2, 3 out of 10. Okay, from there, ground's a great place just to move. So start limbering up, start moving your body, taking care of some thoracic stuff, getting into your shoulders. Everything can just be 3 to 5 reps. Keep in mind, just 3 to 5 minutes, a couple times a day. We got to keep feeding your body movement, so it can relay down new tissue. If it only gets stressed a little bit throughout the day or once a day, it's really not going to send the system the message enough that it needs to heal itself, fix itself. So we're going to do this, some variation or a little bit of it, a couple times a day. And I'm just cruising through 3 to 5 reps, but you can get upwards of 10 and build some capacity here. Might get into a little bit of scap work, a little bit of core work. From there, we can hit a little bit more core work. We're gonna go side plank, downward dog, little calf stretch. Get your ears next to your biceps, repeat. Side plank, downward dog, calf stretch. So to get a lot of this in, maybe 3 to 10 reps. Okay, from here we're upright. Start to get stiff through that leg and tall without locking that knee out. So I'm working on some balance. My feet are trying to grab that ground with that big knuckle. Just getting into some different hip openers. Same thing on the other leg without snapping that knee back. Somewhere in between. Leg swings. And then we also talked about just some activation, and this doesn't even need to necessarily be done during the workout. This can be done when you're standing in line at the supermarket, and we're just screwing our feet in, screwing our feet out. The more focus and attention I have, so right now if I'm just hanging out, it's a 3 out of 10. If I want to really ramp up, I can make that a 4 or 5, and I'm staying out of positions in pain. Pain is going to send the wrong signal. All right, so we'll get some more, just pause it.